and welcome to Psyched for Sanity. I am one of your hosts, Dr. Brindle Doss. I'm a licensed psychologist specializing in geriatric psychology, trauma treatment, and psychological assessments. And one time, I was in a shop in London, and I met Maya Rudolph.
What?
I told her how much I loved her, and then I ran away.
What? Is this real?
Yes.
This is a real story. This
Yes.
isn't like two truths and a lie.
No, we don't play that game here. Do we play that? No, Dylan, we don't play. No,
Not
Dylan says we don't. Not yet. No, it's true.
Ran away.
I have a weird thing. I know. I know.
You have a lot of actual fun facts.
Yeah. I forget. Well, thank you. Actually, thank you.
Yeah. No, it's good.
No, I have a problem. I have not met a lot of like celebrity famous people, and what happens to me is when I meet a celebrity famous person, I lose my ever-loving mind, and I become scared and I become afraid as if they're a monster or a villain. But deep down, I love them, but I'm scared and I want to pee my pants. And what I actually do is literally like, "I love you," and I run away.
You ran away.
Dylan was. We were on our honeymoon. She was buying a brush from a very fancy store. She was there shopping with her partner, Paul Thomas Anderson,
Okay.
the famous director.
Okay.
And I saw her and I panicked. And then I'm
Wow.
like, I literally went to the section of clothes to like get away from her because I'm like, I can't. And then she found me there.
She found you.
She wasn't there looking for me. I was
Oh
not.
my
That's
God,
not what
okay.
happened. Maya Rudolph was not looking for me.
It's like
I
you
want that
must have
clear.
been real impressive, like she was like looking for you after that.
Ouch. So then she was looking like at the same, she ended up at the
No, I
same
get it
rack
now.
of clothing. And she made a comment how she loves his design. I'm like, yeah, they're amazing. And I love your work. And I ran. And then I grabbed
Wow.
Dylan, slightly aggressively, like, we have to leave. We have to leave. And she's like, why? I'm like, I said words to Maya Rudolph.
Oh my gosh,
Yeah.
I can't believe I didn't know that actually.
I'm surprised I haven't told you that, to be very honest with you, because I have other stories, unfortunately,
Okay,
of a
well,
similar but different situations.
we will
that
have a lot of fun facts then in that regard.
God. And I don't understand, but I'm worried that if like, and this is not going to happen, but like, if I were to become famous, I would just have to do all my interviews eyes closed because I could not cognitively and emotionally handle.
You can do it. You just have to work up to it. Baby
Thanks for the
steps.
vote of confidence,
Baby
but I don't think
steps.
you understand how much I literally actually ran with my legs away from this wonderful celebrity person that makes amazing movies, and was a huge, amazing, one of my favorite
You really
actors
okay.
on SNL.
Then instead of being positive, I'll say something like you ruined it, and you should never
Thank you. That feels
meet
that
a
feels more
celebrity again.
comfortable.
Does that? Do you like that more?
Sure. Yeah. No, it's fine. It's more on brand.
Okay, well, I am Dr. Tara McKelvey Parker. I'm a clinical psychologist. I specialize in psychological assessment and treatment for complex trauma and childhood attachment wounds. And my fun fact is actually kind of a basic fun fact,
I'm
but
ready.
I was thinking about it in
Okay.
relation to what I kind of wanted to talk about today.
Okay.
I like true crime.
You do.
Yeah.
Oh,
Okay. It's
okay.
kind of like not super fun because I
That's
feel like,
very
like
standard of
every
you.
millennial, like
Caucasian female
Caucasian female
of a certain age.
liked true crime. So it's like not super fun. But I really, when we talked last time about
Yeah.
what would you be if you weren't a psychologist,
Right.
I did not bring up that I thought it would be super interesting to be like a criminal investigator. You know, like everyone wants. I mean, it
Yeah,
sounds
but you-
so fun.
It sounds fun, but it's like you like being a bachelor's student in psychology with getting a doctorate degree.
It probably
You
would
would not. I love you lots,
I am not detail oriented.
but I don't think you would be good at that.
I would not. I would
Okay.
not. However, I do have like an investigative side of me,
Oh yes.
right?
I,
And
I have
so-
that too. You were recently making fun of me for looking like Sherlock Holmes with my eyebrows.
Oh, that's so true. That's so true.
I don't. Okay, I want to say. Is that it?
Yeah, you look dastardly.
Sometimes I used to when I was bored and I would be at like day jobs when I was younger. I would like play games to entertain myself, and I learned how to wiggle my ears, and I learned how to like utilize one eyebrow. I don't know why. I just was trying to entertain myself when no one was coming to my register when I was a grocery store cashier.
We were doing
That's a different
very
story.
different things to entertain ourselves, but you know.
There's my Donald Duck laugh again. Dang nablet.
Anyway, investigative.
Detectives.
Yeah,
But
detectives.
what kind of detectives are we?
Well, I think that's why I like testing so much.
Same.
Okay,
100%.
because it really allows me to put on my investigator brain.
Yes.
I really, really like psychological testing because for me, it really I want people to understand themselves deeply.
Sure. Before we go further, though, I think a lot of people, like I think other psychologists, other therapists, mental health professionals, they might understand the difference between psychological assessment and therapy.
Yeah.
But I wonder if like the general population knows, because I get calls all the time where it's not really clear. So could you explain the difference and talk about the importance of, I mean, both obviously for us?
Yeah. That's a big question.
I know
Let
it
me
is.
think about it. Okay. Well, the main difference
Yes.
between testing and therapy. Therapy, you are coming in usually long term to work on a problem in like a top
Right.
therapy format.
And long term could be several months.
I guess it could be short term to long term,
several
but
years. It depends
yeah,
on
it
the
depends
need and the
on
challenge.
Yeah, it depends on the
Okay.
challenge. It depends on the type of therapy. Like
Right.
solution focused, you may come for a few sessions,
Right.
right? Because you have a problem, you have a goal. That's what you talk about.
Correct.
But the type of therapy that I do is usually pretty long term,
Sure.
and so that could be years. But usually you're building a relationship with your, between patient client,
Right.
and you're talking through some kind of issue, and
Okay.
therapist is using some kind of skills or modality to sort of treat.
And a modality is for, again,
Yeah.
is a way that a therapist or a psychologist or a mental health professional operates and how they view mental health challenges and mental health strengths. So that is a modality. So in school, we learn and are asked to kind of figure out what
Yeah.
therapeutic modality would be best fit for us.
Yes.
So back to
Exactly.
assessment, though. So what's the
Yeah.
difference here?
Yeah, so assessment, well, and this is a little tricky because I do traditional assessment for diagnosis,
Sure.
right? Like a lot of times, traditionally assessment is if you are looking to see if you meet criteria or you have the symptoms, right?
Right.
That sort of meet criteria for a specific diagnosis.
Right. And another way to say that is basically if you have the disorder at this
Yeah,
time.
do I have an anxiety
Yes.
disorder? Do I have post-traumatic stress disorder?
Right.
Do I have
Absolutely.
ADHD, attention deficit hyperactivity disorder? So traditionally, testing is really more focused on diagnosis.
Like figuring out which of these best fits the person's experience.
Yes, and then here's a treatment plan. Here are some recommendations, accommodations, referral sources, and so that could be super helpful to
Yeah.
take to therapy when you have a diagnosis, and
Right.
maybe your therapist can fit a particular modality or
Right.
type of therapy to that diagnosis.
Or on the other side,
More.
if they're engaging any type of psychiatry and or a medication provider.
Yeah.
If you're looking for any type of psychotropic pharmacological medications, if you think you have ADHD and you're on medication for ADHD, but when in fact you don't actually have it, that can be a really big deal. And to be honest, kind of problematic. Because we don't want to take medication for a diagnosis or a disorder that you don't actually have.
Yes.
So that's one thing. That's one of the many reasons why I think psychological testing is so important and critical.
Yes, and I do a type of testing, psychological assessment that
Yes.
is called collaborative or therapeutic.
Okay.
And so it sort of blends like
That's
a traditional.
You do have a very specific niche on that,
traditional
yeah.
assessment where we're kind of like figuring out diagnosis, but then also we're developing specific questions that
Right.
the patient wants answered through the assessment, like
Okay.
why do I have anxiety?
Right.
Right? Or if a person doesn't have ADHD, like why am I having trouble focusing? And
If I don't have ADHD.
If I don't have ADHD, and so we really I use projectives, and I can talk more about
What is a
that
projective?
Well, yeah. So there's usually an assessment. There's objective and there's projective testing. Objective is the face valid stuff. It's the stuff that you give to a patient or to a parent or to a teacher to fill out about a person's behavior.
So it might be like for those of you listening or watching at home, it might be a questionnaire at a doctor's office. Even medical providers will sometimes give brief, what they call depression screeners. That is a objective, face valid measure.
Yes. And so for me, that really only gives me a certain percentage of the puzzle.
One facet
so
of the
to
diamond.
speak. Yeah, because it really only, it's face valid. It's what you know about yourself, or it's what you want to tell
Share.
me. So what you want
Right,
to
what you
share,
choose to share.
right? So the projective assessments that I do to really kind of look under the hood are usually storytelling tasks or ink blot or sentence completion or drawings.
So you mentioned ink blot. So the official name of that is the Rorschach.
Yes, I didn't want to say it because I didn't want people to look up no one look up the cards.
Why should they not look up the cards?
Don't look at the cards because then if you want to take it, it could spoil the results.
Yeah.
So projectives will help me kind of look under the hood, so to speak. And so then I can answer some of these complex questions about why does the diagnosis even exist, and then really help people like figure out. And this is really helpful for when we have complex trauma because there's multiple diagnoses potentially, and like we're really looking at complex pictures. So
in complex trauma, like we've had awareness about PTSD. And the impact of traumatic events across the lifespan. We have research and data over that, even though it's still, I would say, still a relatively newer exploration. Mm-hmm. However, I think the research basis and the functional grasp of complex PTSD is an emerging area, in my opinion. I think there's still lots of things to be explored and understood. Mm-hmm. And I think a lot of people walk around, but I think we've all heard a friend or a family member say, "Oh, I have ADHD." Or I have bipolar disorder, you know. And I think people seek these diagnoses for a reason. I think they look for them they want to make sense of their experience in their world. Mm-hmm. And that's what I love about assessment. My favorite type of session or interaction is either an assessment or a first session.
Oh, yeah.
And most people...
the information gathering.
Hate them.
Did you know that? Love that. I love them
Me too. I love them. Give them to me all day long. Mm-hmm. I think I love the puzzle, and I love... Is it this or is it that? I love figuring out all those dynamics.
Looking at the scores and kind of figuring out what does this subtest measure
and what does this mean for that? And when they interact, when you have this score with that score,
and it all fits together like a puzzle. You have like a low score here and a low score here, and it's sort of like putting this picture together, which is really exciting.
It's so cool. It's so interesting.
And usually
it's like solving a mystery.
And it's meaningful for patients.
So important.
When they are people who feel very lost, who have maybe had multiple diagnoses thrown at them.
Without actually proper testing. We could talk about that for years too.
Yes.
We won't. But we
Yes,
could.
yes. ADHD, the appropriate diagnosis of ADHD is like my passion project and like I have like my, all of my research in grad school is about all of that. And so that's where complex trauma comes in because complex PTSD, the symptoms are so similar to those with ADHD, and it's the same for anxiety disorders. And then you're testing kids, and it's even more complicated because everything looks like ADHD because kiddos express so much of their emotion in their bodies and through their behaviors and stuff. So but yeah, I know you love testing.
I do love
and we both went to the same postdoc that was really very focused.
On testing. We did other things too. We did a lot of things there. It was a lot.
It was a hard year.
We talked about that a little bit.
Yeah.
But we had that sort of beginning, I think, foundation training base.
Yeah.
And I think, I learned a lot from there.
And I do feel like the clinicians and our supervisors, they had that sort of like maybe investigator they wore that hat, I think they did teach us sort of how to look at all of these assessments together and to kind of put together a puzzle.
I remember learning, I think I learned this prior to the postdoc as well, but I think it was reinforced during our postdoctoral fellowship, which I want to pause and make sure. So a postdoctoral fellowship is when a psychologist is finished all their school and all their requirements to have a degree, either a PsyD or which is a doctorate in psychology, or a PhD, which is a doctorate in philosophy. But after that, you get all through done school, you don't have a license. You need to get a license. And the way you get licensed is by completing a number of hours under a supervising psychologist. And you take many tests, which we talked about.
Lots of tests.
But this postdoctoral fellowship is that year. It's supposed to be, generally it's a year, sometimes it's 2, where you gain those hours so that you can apply to become a licensed psychologist in the state that you're residing in.
Yes.
I always want to make sure.
Yeah, good. No, that's great.
Because you and I dive in because we're so excited about it. But I think for me, we were really taught at that job site together that the moment you interact with either because we did a lot of testing for kids. The moment you interact with either the patient, if they're an adult, or the parent and the child, that's when the assessment begins. your observations in the waiting room.
Oh, yeah,
Your
for
observations walking to the testing room. I think those little details I still carry with me today.
Yeah, yeah. I think it was really valuable training.
Absolutely.
And it's so interesting. I think we went in very different directions.
Right, for totally different reasons.
Yeah, after postdoc in terms of therapy and testing. But I
100%.
wonder if you could speak a little bit about your
Yeah.
testing experience.
Yeah, I did a lot of, I feel like I've done a lot of different things. I think as far as testing goes, after that postdoc year, for sure for me, that was it's a really hard year, regardless of where you do it or what you do in that year, because you're doing so much. But I kind of needed, honestly, a break from assessment, because we were churning. How many reports did we have to do a week?
4?
So 4. We say the number 4. How long were these documents?
They were like 30 pages long.
Sometimes longer.
I mean, really long.
30 to 50 pages.
It was sort of like a bit of a factory.
It
You
was.
kind of, you really learned to do it fast, and you really learned to do it well in a
Efficient.
specific way.
Very specific way.
Very specific way. And so I know for me, when I went to private practice after that, I had a hard time breaking out of that sort of
Interesting.
mode for a while.
Yeah, I didn't know that.
Yeah, I really had to rethink the way I did testing, and I think
Recalibrate.
I did have to recalibrate, and I think I was able to take some things from the way they did it and incorporate it into mine.
Right.
But because I'm in private practice, I've been able to take my time
and do it your own way.
and do it my own way. And
take
really,
your training and make your own amalgam of what's your
yes, and so to
assessment
develop
process.
kind of like a niche for what I do.
Yeah.
And I think
So when I needed a break, honestly, after that year from assessment, and I took it, and I just dived into doing therapy full time. And I, we talked about this in the past, but working in long-term care or nursing home settings, I really just loved that. And we're going to talk about that, I think, at a later date.
Yeah.
The therapy side of our lives professionally. And, but for assessment, I still had to do initial evaluations. And those are like, they call mental health professionals call them all kinds of names. In my world, sometimes they're called a diagnostic assessment. Other times they're called an intake evaluation. And during that evaluation, you usually administer a face-valid measure, a brief screener, and you have to come up with a diagnosis off of sometimes very little functional data. For a psychological assessment that we were trained to do, we would spend 4 to 6, if not 8 hours, or more than one day, administering different tests.
yes,
To the person, the child or adult. In the world I went into, I had a situation where the more people you saw, the more money you make. And I was a young baby doctor, and I was trying to pay my student loans. I'm still trying to pay my student loans.
yeah. And I don't want to talk about
Okay,
it.
well, she doesn't want to talk about that, guys.
I'd like to avoid.
Don't ask her.
student
Don't ask her about her student loans. That'll also be another podcast episode, right, Rudy? Anyways, so I had to develop really fast, assessment abilities and really glean data from a lot more observational, and also tailor my questions
Yeah.
to collect data in the fastest amount of time.
Yep.
To get the most amount to be accurate and to be the most helpful to guide a treatment plan. Because if you have the wrong diagnosis, certain treatments don't apply to all diagnosis. So,
Yeah. Gosh, that sounds actually really kind
and
of stressful.
I love it. I loved it. I still do this. But after I did that in long-term care for a while, I went to a different setting that was also, I don't know, I'm weird. You guys that listening at home know I'm kind of weird, which I'm fine with. I'm really good with it. But I went
I don't
to
know
work.
if you are. If you're brainy.
I'm mostly okay. I'm like, it's like that Friends episode. I'm like 90% okay with it. I'm 90% okay.
Okay.
Yeah.
Okay.
No, I went to work during COVID because I was in COVID
Yeah, I know.
during the nursing homes, which was one of the many, unfortunately, ground zeros for COVID-19. And that was really, really hard and really, really difficult
Yeah.
as a psychologist and a clinician to have your patients that even though they're in nursing homes, that doesn't mean they're going to die tomorrow. And some of them, unfortunately, they did pass away,
That's
in my estimation, before
Yeah.
their time. And like that, I still remember and carry some of those people with me for sure. But that experience was really hard and difficult, and I needed a change and I needed a break. So I somehow thought it would be a good idea to go work in the federal prison system.
Yeah, you've had a lot
I know.
of different
Right.
kinds of experiences.
Absolutely.
And that makes it really, you can really, you have a variety of testing
Right.
experience because of that reason, and
Exactly.
in different settings. And
so, yeah, in the federal prison system, similar but different to the long-term care settings, you have a short amount of time and very limited data to get the most accurate diagnosis possible to guide treatment.
Yeah.
So there we would do intakes, and every person that comes through this system is required to be seen by a licensed psychologist. By a psychologist. And, they have a very brief form they fill out, and you have to learn how to ask certain questions from a very reticent person. Reticent meaning they don't want to tell you nothing. They don't want to tell you. Sometimes they do not want to talk to you at all.
Yeah, that sounds
Sometimes
hard.
they refuse to fill out the form. So it's tricky. As my 4-year-old say, it's tricky. And so I learned to ask questions in a way, and I also learned to read what kind of like in poker, I guess would be called a tell. Like if someone paused too long before answering a question, or the way they answered the question,
Oh, that's
I would
so interesting.
circle back to that and say, you answered it this way, but listen, and I would just say this, like, look, I'm not trying to get your whole story on this. I know I'm a stranger with a short haircut, and you don't want to talk to me, and that's fine. I'm just trying to sign you up for the most programs that might get you early release or that might benefit you. I'm not here to get into your business. And that line worked really well for me because, A, I mean it. I think it helps when you're authentic with people that you're trying to treat and assess. I meant it, and when you're doing these evaluations, these brief intakes, brief is a loaded word. They weren't always brief. Sometimes they're long, sometimes they're short. When you're doing these intakes, if they don't acknowledge all parts of their history and their past, they can not be eligible for certain programs, which does limit them, but they don't know that. And it's scary when you're going in there, whether, no matter what you feel about your alleged crime, situations like that, it's a really hard environment to go into.
Yeah.
And so it's very understandable for me that someone would be kind of reserved in that setting. So I learned to look for the tells. I learned to figure out a way to word questions to get the most amount of data in the least amount of time as possible. And I think now as I'm transitioned to private practice, I still employ varieties of those techniques.
Yeah, it'll be really interesting to see
over time.
Like what your testing practice looks like. Like I said, I think I felt like I was trying to recalibrate a little bit when I started, and I feel like I have developed a niche, in this sort of therapeutic or collaborative assessment. And so that's nice, but I think both of our experience is really important in the different kinds of testing that we do. And I think, I just think testing is really important, and I just really like it.
Right.
So,
yeah.
So, if anything about this episode resonated with you today, leave some feedback in the comment section.
Please. Talk to us.
Yeah, let us know. We'd love to hear from you.
What do you want to take away from today in our conversation? What do you need?
I need some water.
Are you parched?
Yes, I think I am. Yeah.
I actually get really parched when I'm doing testing and assessment.
I get parched and also hungry. Like
Weird.
It's a lot of brain
I don't think
power.
People who are on the other side of the chair recognize how you have to be doing 2 to 3 things simultaneously to manage the assessment.
Yes, exactly.
That'll be another episode.
Yes. So parched. Yes, I'm parched.
So you need water.
I need some water. And what about you?
You know what? I know I'm a cheese ball. Giant cheese ball. I think I don't need anything besides the water as well, some H2O. But I think I'm taking away just appreciation for the complexity of our work and the importance.
Yeah, definitely.
And I think that's what I'm kind of carrying with me today as we finish our conversation. I love chatting with you about this stuff.
Yeah, me too.
Nerding out.
Yeah.
Hey, can we make our own handshake?
Like right now?
No, later. But can we do that?
Oh my God, are we gonna put it on here?
I don't know. I'm just spitballing. Rudy says we're putting the handshake on the podcast.
Okay, we're putting the handshake on the podcast.
But are you committing? I feel like this is how I talked you into the
free
podcast.
Free will. I'm just.
You can say no to the handshake. You cannot give consent.
I'm not conflicted, Brindle. I'm conflicted. Different parts of me want different things. Okay.
When you and your parts get a consensus vote, will you let me know?
We can do it.
Handshake. podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.